Dr. Chi Ofebu says there should be 5 full-time doctors at the emergency department in Clearwater, BC. Right now, he says there are only 2.
We signed up to help the patients make sure that we keep up with their health. But at the same time, one wonders if we're actually taking care of ourselves.
Now his emergency department has been closed until at least Monday. For those needing immediate medical care, the closest help now is in Kamloops, over an hour away.
Hanging in there, hoping that we'll get the help that we've been promised that is coming soon. But it's almost 1 year now, and that help is still nowhere to be found.
It's not just in British Columbia, it's in every community or every province across the country, largely in rural parts of our country, but not exclusively.
BC Premier John Horgan will chair this week's Premier meeting. They are expected to call on the federal government for more healthcare funding, a drastic raise from 22% to 35% of the cost. But healthcare professionals will be looking for more innovative solutions, not just money.
We need different models of care to attract and retain family doctors. We need different methods of payment and remuneration to retain people in that specialty. We need support with the infrastructure of community-based care, and we need integrated team-based care so that family doctors can care for aging Canadians and people with more complex disease.
Rural communities can be especially vulnerable. When 3 nurses contracted COVID-19 last week, reducing the staff to just 2, this Doctors Ontario ER was shut down.
So it's almost like a perfect storm, really, of post-COVID increasing volumes in the emergency department with a diminished ability to respond by virtue of nurses leaving the profession.
In hospitals across the country, a burden borne by patients as well, as everyone waits for answers. Yasmin Gandam, CBC News, Vancouver.